Hello everyone, this is Jim from Benzie County EMS. Today we're going to cover our new policy and procedure on legal draws. The objectives of this presentation are to discuss and value the proper procedure to obtain a legal blood sample. We are going to discuss and demonstrate the proper technique in obtaining a legal blood sample, and we will ensure that the legal draw has been documented appropriately. The purpose is once again to ensure that all blood draws done at the request of law enforcement are done in a professional manner consistent with established techniques. In each of the primary rigs, as well as the echo, you will find a venous blood draw kit, as well as the sample kit that has been provided by the Benzie County Sheriff's Office and the Michigan State Police. The kit itself contains 2 butterfly needles, 2 tourniquets, 2 10-milliliter syringes, 6 iodine preps, 3 2x2s, 3 band-aids, a sharp shuttle, and 2 IV catheters, a 20 gauge and 18 gauge. The blood sample kit itself will be a separate box aside from the soft pouch. When obtaining the blood sample, whether it's in the field or it's in the jail itself, it must be done in a medical facility or a medical environment. If done at the jail, it should be obtained in the medical room. If done in the field, it should be done in the back of the ambulance and then documented as such on the form you will see here in just a moment. Request to see that the warrant is valid, and we check this by checking to see if there's a judge signature to make sure that the correct patient information is on the warrant and matches the patient you are about to take the draw from. Make sure there's a correct date on it, and make sure that the sample being requested is noted on there. In the boxes provided by the MSP, it gives an option for urine or blood, so make sure that a blood sample is noted on there. You'll obtain a blood draw kit sealed from law enforcement officers or the kits that are stocked in the trucks. Now, we want to make sure that the kit integrity seal, as seen here, is still on the box, or we will need to grab a new kit. We are going to open the kit and take the alcohol and drug determination form out so that law enforcement can complete them. And they'll be completing these 2 sections here, the agency information as well as the incident information. And these should match the subject's name and all the pertinent data. So this is their 2 sections. Once that has been verified, we're going to get a full set of patient vitals per this policy, and that will include a blood sugar, pulse, respiration rate, blood pressure, and pulse oximetry reading. The reason behind this is we want to make sure that the patient is not actually having a hypoglycemic incident or possibly hyperglycemic. So if this is found, the paramedic is to invoke a general pre-hospital care on this patient for any blood glucose less than 60 or at their discretion. The sample should be obtained in the presence of law enforcement, and we do not want to use any alcohol or alcoholic solutions to sterilize the skin surface. Use the provided iodine prep pad. There's one inside the box as well as the ones provided in the soft pack. The alcohol preps themselves most likely will not, but they can be used as a defense to show possibly a positive alcohol level on the patient as you puncture the skin as a way of trying to beat the draw, so to speak. You'll draw 2 tubes of venous blood from the patient in the presence of law enforcement, utilizing the provided blood access draw equipment. Inform the patient or subject in the presence of law enforcement that no alcohol was used in sterilizing the skin surface, needle, or collection tubes. Once this is done, we are going to slowly invert the blood collection tube several times. This can be, if you have any questions on this, you can see the policy and procedure itself with the link to the Mayo Clinic on the justification as to why we actually invert the tubes. The following will be videos of an actual draw placed as well as how to invert the tubes.
So.
So the iodine prep pad was just pulled out of the box. The site was prepared with the iodine.
This may hurt. Here comes yours, Mom. So the goal will be to get it to at least to the gray line. Okay. Now invert. Gray line. Back and forth. Very good. That's enough.
Okay, so that is a successful draw, followed by the inverting of the tube, which helps mix the solutes that are in the tube that help keep it from hemolyzing. The next video we're going to watch is the proper procedures how to utilize the safety features on the butterfly needle. The green wings are pulled down as the yellow sheath is pushed up over, locking the needle into the safety hub itself. Once this is done, you're going to complete the blood specimen labels by entering the name of the subject, date, and time of blood collection, the officer's name, your name, the agency name, in ink, and place them in the blood tubes, on the blood tubes. So as seen here, the medical facility name in green will either be the ambulance or the Benzie County Sheriff's Office Medical Room Jail. On the orange line, with the orange arrow pointing to it, will be the printed name of the person taking the samples, followed by the red line, which is the signature of the person taking the samples. The blue arrows point towards what was pulled or what was sampled in the tubes, which would be blood in this case for tube 1 and 2, followed by, under the purple arrow, the time of collection. This will all need to be documented by the EMS provider. When all three forms or sections of the form are complete, hand the pink copy to law enforcement, and following the evidence kit directions, place the labeled tubes in a cardboard holder. This should be done placed in the provided Ziploc bag, sealed, squeezing any remaining air out of the bag. The bag with the sample inside, as well as the remaining white and yellow copies of the form, should be placed in the kit and given to the officer. The officer will then seal the kit with the provided kit shipping seal, seen here. Make a copy of the alcohol and drug determination form that you have given the officer, the pink copy, and attach it to your electronic patient care record. Upon returning to the station or in the truck, complete the Benzie County EMS run form on ImageTrend, which documents the following. This will be done as a normal incident run form. It'll document the blood collection process as shown in the procedure, or as outlined in the procedure. It'll document the patient demographics, any medications and allergies noted from the patient, the vital signs, which includes the blood glucose as taken prior to the draw, and anything that you may have had to invoke as far as pre-hospital care for that patient, if it is 60 milligrams per deciliter or less, or at your discretion. That's the end of our